on Hold 'em Accountable, a breaking news update. Women apparently have hormones. Wild discovery. Someone alert Congress before they try to regulate that too. In other headlines, the maternal mortality rate in America is so high that other countries are sending us thoughts and prayers. Postpartum depression is still treated like a personal failure instead of a medical condition. Because nothing says modern healthcare like blaming a woman who just created life. And menopause? Oh, don't worry. The medical world is still shocked to learn that it exists. Apparently, half the population going through a major biological transition still considered a niche topic, like stamp collect. Welcome to America, where women carry the invisible load and the healthcare system carries the bare minimum. Let's talk about women's mental health, hormones, care gaps, and the invisible load, and why this conversation is 200 years overdue. Good evening, Indiana, and everyone watching from across the country. I'm Derek Holder, retired Marine, father, husband, and your host of Hold 'em Accountable.
And I'm Kristie, advocator, host of the upcoming Hold 'em Accountable, Breaking the Silence. And tonight, I'm not going to just allow my husband to run the show on this topic.
And tonight, we're diving into a topic that affects every family, every household, and every community, whether we talk about it or not. Women's mental health, not the Instagram version, not the self-care Sunday version, not the go take a bubble bath and manifest your way out of a societal failure version.
No, the real version. Medical blind spots, invisible stress, gender expectations, and a system built by men for men, based on research done on men that still somehow confused when women have different symptoms.
So buckle up, we're going deep. History, receipts, hot buttons, policy fixes, and yes,
A hold 'em or fold 'em mini rant that will absolutely step on some toes.
as it should.
Good morning, folks. It's Jennifer David. I am just answering a question for a friend of mine, Derek Holder. He had asked about women's mental health and what is something that we want men to know without us teaching them. My number one thing is, honestly, is to listen to us, to listen to what we have to say, and to take it at face value, to not try to fix problems unless we ask you for help. A lot of times we just want to talk about whatever it is going on. We just want to have our feelings validated and somebody to talk to. So that is the number one thing that I would say is use your listening ears and just be patient with us.
All right, let's dig into the history. And this is important because the issues women face today didn't just appear one morning like a pop-up ad. No, they were built brick by brick across centuries of medical habits, cultural expectations, and straight up willful ignorance. And because this is Hold 'em Accountable, we're not sugarcoating a damn thing.
For centuries, women's mental health were turned into one convenient little bucket, hysteria, a term literally based on the Greek word for uterus. Anything from anxiety, trauma, depression, grief, irritability, pain, or literally any mood whatsoever was blamed on the uterus. Misbehaving like some kind of emotional gremlin, doctors actually believed that the uterus could wander around the body. Okay. Medical science says she's not depressed. Her womb is lost.
Yes, that was the real theory. Instead of treating trauma or depression, women were told, lie down, stop thinking so hard, try smelling salts, maybe read less. The idea that women's emotional distress was biological chaos rather than a mental health issue shaped everything that came after. Fast forward to the modern era. For decades, women were excluded from clinical trials because of this gem of a reason. Their hormones make the data complicated. Translation, we don't want to do the extra math. So instead of studying half the population, researchers studied only men and then wrote national medical guidelines as if women were just small men with pink razors.
That's how we ended up with male modeled ADHD, male modeled autism, male normed heart attack symptoms, male based psychiatric dosing, male expectations for stress response, male norms everywhere.
And then the medical world was confused that women presented symptoms differently. They didn't present differently, they were never studied. Time for one of the biggest healthcare oversights in modern history. ADHD and autism were defined based on boys. Boys act out, boys fidget, boys hyperfocus, boys disrupt classrooms. So that became the diagnostic template.
But girls often mask their symptoms, daydreaming instead of acting out, internalizing stress, perform perfectionist as survival, mimics social cues, appears quiet, good, or mature. So what were they labeled? Shy, sensitive, moody, over emotional, a perfectionist, or the classic, she needs to try harder. I've heard that a lot. No, she needed a diagnosis and support.
Entire generations of women didn't find out they were neurodivergent until adulthood, after decades of unnecessary guilt and burnout. Postpartum mental health might be the single most ignored chapter in women's history for centuries.
Postpartum depression was not a diagnosis. Postpartum anxiety wasn't real condition. Postpartum psychosis wasn't discussed, and postpartum trauma wasn't even imagined.
Instead, women were told,
Motherhood is hard. Don't be dramatic. It's just hormones. Be grateful you have a healthy baby.
meanwhile, women were experiencing
Crippling depression, extensive anxiety, terrifying intrusive thoughts, complete identity collapse, trauma from childbirth, isolation, sleep deprivation, hormonal chaos.
and society's response was
Try smiling.
there was no follow up care, no hotline, no screening, just a 6-week appointment and a pat on the shoulder. Generations of women suffered in silence because their symptoms were framed as a moral failing instead of a medical condition. As women entered the workforce, gender bias didn't disappear and put on a suit and tie. Any sign of stress?
She's emotional.
Any sign of ambition?
She's aggressive.
Any sign of burnout?
She's just not cut out for the leadership. But when men showed the same behaviors,
He's decisive. He's strong. He's passionate. The double standard had a double impact. Women weren't allowed to show stress. And when they did show stress, it was used against them. So women internalized everything: burnout, anxiety, frustration, trauma, all shoved it down to look.
professional.
This wasn't empowerment.
This was survival.
Then came the era of the supermom, the ultimate impossible standard. Women were expected to
Raise the kids, run the house, work full-time jobs, stay fit, stay youthful, keep everyone emotionally stable, manage schedules, and act like none of this was stressful.
This wasn't empowerment.
This was unpaid labor with a PR campaign.
The supermom myth turned exhaustion into a personality trait.
She's so strong. She handles everything. She never complains.
Of course, she didn't complain, because when she does, she gets labeled as,
Difficult,
or
ungrateful.
for decades, women were drowning while society applauded their ability to tread water. Here's the quiet part, the part that doesn't make headlines, but absolutely destroys mental health: the invisible load. This is the
Emotional labor, planning labor, remembering labor, anticipating labor, organizing labor, household management labor that women carry whether they work outside the home or not.
men often help with the task.
Women often carry the management.
There is a difference. Men do the dishes.
Women remember the grocery, plan the meals, schedule the dentist appointments, track the kids' allergies, and update the family calendar.
The invisible load is relentless. And historically, nobody counted it. Nobody supported it. Nobody paid for it. Nobody studied it. Yet it's one of the biggest drivers of burnout, anxiety, and depression. This is not personal failure. This is systemic design.
And finally, the culture gag order. Women were raised with a script: don't complain, don't be dramatic, don't overreact, don't talk about your feelings too much, don't be needy, don't cause problems, be low maintenance.
Low maintenance?
Try low support.
Women weren't just discouraged from talking about mental health, they were punished for it. The silencing wasn't accidental, and it was cultural. It was enforced. And for generations, it created a world where women apologize for pain instead of receiving care. So that's the history, full of receipts, context, and all the ways women's mental health was ignored, minimized, or straight up dismissed. This wasn't chance. It wasn't nature. It wasn't unavoidable. It was designed this way. And if something was designed,
It can be redesigned, and that's exactly why we're here tonight.
I think it's nice that more people are talking about mental health, especially when women are having problems postpartum. For a long time, they were always told how they will get over it. Now it's nice to know that other women have problems with it as well. But we don't really talk about the mental problems women have when we start to go through perimenopause or menopause. That seems like it's still a hush-hush thing. A secret no woman should be talking about or asking about. So many things are going on, and one might feel alone because of not knowing who to talk to. The emotional outburst a woman might have. I think that we talk a lot about mental health and not everyone taking it seriously. Some people are having a hard time trying to find places to go to or insurance to kick in. I know a few people who have tried going to a place and the phone number they were given was not in service. The address they were given was not even the right address to a place, or maybe it had closed. Or a place they go to, they are told, "Oh, sorry, we don't have that service," of what they are looking for. Why does it have to be so hard?
all right, we covered the history, and honestly, that alone should have lit a fire under half the state legislature. But now we're talking about what's happening right now.
Not last century, not last decade, today.
Women's mental health isn't a niche topic. It's not women's issues.
It's a public health, it's family stability, it's workforce health, and it's a backbone of every community.
So let's break down the big fires burning in real time. Let's start with the big one, maternal mortality. And to be very clear, the United States has the highest maternal mortality rate of any developed nation. Let me repeat that for policymakers in the back. The richest country on earth is the most dangerous, wealthy country to give birth in.
That should be a national scandal.
The real numbers, women are dying.
During childbirth, days after, weeks after, months after.
And many of those deaths are preventable, not rare, preventable. The mental health link, we have to talk about this. Mental health is directly tied to maternal mortality. When postpartum depression or anxiety goes undiagnosed,
Women skip follow ups, women don't seek care, partners and families miss the warning signs. Physically, symptoms are dismissed as emotional, serious complications get misdiagnosed as a stress.
mental health and physical health are not separate.
Not during pregnancy, not during childbirth, not postpartum, but our system treats like two different universes.
Now let's talk about postpartum depression, or PPD. 1 in 7 women will experience postpartum depression.
That's not even a fringe issue. That's not a rare crisis. That's a major public health emergency.
But how do we treat it in this country? We treat it like a moral weakness. The stigma, women with PPD are often told.
Motherhood is hard. Maybe you're just overwhelmed. It's just the baby blues. Don't be dramatic. Be grateful.
Meanwhile, their hormones are crashing. Their sleep is destroyed. Their identity is shifting. Their support is limited. Their brain is rewiring. Their entire life is changing instantly. But God forbid they say out loud.
I'm not okay. I'm not.
The symptoms nobody talks about. PPD isn't just sadness, it's
Rage, shame, detachment, panic attacks, exhaustion. So deep it feels physical, intrusive thoughts, the feeling of being trapped, the fear of being judged, unfit for saying the truth.
we tell moms if you need help, ask. But when moms ask, they're often met with
Long wait lists, no insurance coverage, no childcare, no paid leave, no dedicated specialists, no standardized screening.
telling moms to ask for help is useless if there's nowhere to ask. And then there's postpartum anxiety, or PPA. This condition is massively underdiagnosed because many providers don't know what it looks like.
Racing thoughts, obsessive fear with the baby's safety, compulsive checking, inability to rest, irritability, physical symptoms like chest tightness, dizziness, and nausea.
This is not new mom nerves. This is a medical condition. But when women report it, they get told that's normal. New moms worry. You're just tired. Meanwhile, their nervous system is in full alarm mode 24/7. Postpartum psychosis affects 2 per 1,000 births. It is rare, but it is serious.
This condition is an emergency, not a scandal, not a headline, not a hashtag.
Symptoms can include
Hallucination, delusion, severe confusion, inability to sleep, rapid mood shift.
but because we've stigmatized it, women hide their symptoms until it's too late. Families don't know what to look for. Providers don't warn them. Society doesn't talk about it. Silence is dangerous.
Now, let's talk about something long overdue. Menopause. It's finally having a renaissance.
Oh, okay. That sounds fun.
It took decades for the medical field to admit the menopause affects mental health. Symptoms include
Mood swing, irritability, brain fog, anxiety spikes, depression, sleep changes, cognitive issues, energy crashes.
but historically, doctors treated menopause like a punchline. Women were told,
That's just aging. Power through. It's natural. It'll pass.
imagine telling someone with a broken leg.
Just walk it off.
Hormone replacement therapy, HRT, got a bad reputation after early studies scared everyone away. And guess what? Those studies were done on women, much older women, the age group most likely to benefit. So millions of women went untreated for symptoms that could have been managed years earlier. This wasn't medical precision.
But it was medical fear.
Burnout. That's one huge thing. Women were 3 times more likely than men to be experiencing burnout
Why?
because women carry the paid workload, the domestic workload, the childcare workload, and the emotional workload all at the same time.
And then they get blamed for not being resilient enough. Burnout isn't a personal failure, it's a predictable outcome of being assigned the majority of unpaid labor in society.
We can't talk mental health without taking money. Women are,
Paid less, charged more,
hello, pink tax.
spending more time caregiving, more likely to reduce hours after childbirth, and more likely to be single parents, more likely to lose income due to family needs.
And then we wonder why anxiety is skyrocketing.
Finances and mental health are directly connected. When your bank account is stressed, your brain is stressed. Here's one of the biggest fires right now: medical dismissal. Studies show that women's reports of pain are taken less seriously.
Women wait longer in ERs. Women get untreated for pain. Women are more likely to be told symptoms are psychological.
This isn't outdated bias.
This is current bias.
When women say,
My chest hurts.
providers think anxiety. When women say,
My period pain is severe.
providers think exaggeration. When women say,
My meds are not working.
providers think emotionality. Dismissal isn't annoying, it's dangerous.
It leads to misdiagnosis, delayed treatment, and preventable suffering.
And then we've got the modern mind melter, social media. Women, especially moms, face
Constant comparison, constant pressure, constant judgment, 24/7 visibility, unrealistic standards, algorithm driven perfection traps.
your grandmother didn't have to compare her parenting skills to 8,000 Instagram moms with color coordinated pantries and perfect lighting. This era is brutal on mental health. And here's the truth that ties it all together: women's mental health care isn't broken.
It was never built.
The mental health system was designed around
Male research participants, male symptoms profiles, male work patterns, male social expectations, and male definitions of productivity.
everything women experience, from postpartum depression to burnout to hormonal shifts.
Get squeezed into frameworks that never fit.
So that's where we are today, a landscape filled with real crises.
Maternal mortality, postpartum depression, postpartum anxiety, menopause neglect, burnout, dismissal, economic pressure, and the visible load.
This isn't theoretical. This is happening right now, today, in every town, every neighborhood, every state, and the system still pretends it's invisible, but not on this show.
Women aren't more emotional. They're simply allowed to express emotions in ways society labels as feminine. Hormones affect everyone, including men, but society rarely calls men irrational when their hormones influence mood, stress, or aggression. Emotional expression is human, not gendered. And research shows women are no less rational or self-controlled than men. The stereotype comes from outdated beliefs, not biology.
All right, we've talked about the history, the big structural bias that shaped the world women are living in today. We've talked the hot button crises, the fires burning right now. But this next part matters just as much. How did we get here? How did women's mental health fall through every crack imaginable? How did the system become this fragmented, underfunded, uncoordinated mess? The biggest structural problem is also the simplest. For most of modern medical history, the default human body was assumed to be a man. That was the test subject. That was the baseline. That was the standard model in medicine.
Women were included because, and I swear, I'm not making this up, researchers said women's hormones made results messy. So instead of doing more careful science, they did more convenient science.
Examples of male centric defaults. Dosage testing for psychiatric meds was done on men. Heart attack symptoms were defined from men. ADHD criteria were created based on boys. Autism was modeled on boys' behavior patterns. Sleep studies, mostly men. Pain threshold studies, mostly men. Stress response research, almost entirely men. And then everyone's shocked when women's results didn't look the same. The consequence?
Women's symptoms looked unusual. Women get misdiagnosed, women get dismissed, not because they're confusing, because the system used the wrong blueprint.
Let's be very clear about what was happening. Women weren't excluded from research because of complexity.
They were excluded for convenience. Researchers say that women's hormones fluctuated. Women's cycles vary. Women's introduced extra variables. Well, yeah, that's kind of how biology works.
Instead of studying the complexity, they avoided it. What happens when you avoid complexity? You don't understand anything.
We're talking hormones influence, mood regulations, sleep, energy, metabolism, emotional processing, stress response, and anxiety and depression.
These fluctuations should have been mapped in detail. Instead, they were blamed and ignored.
Now, here's one of the biggest designs failures in modern healthcare. OBGYN care and mental health exist in completely separate silos. They don't share records. They don't screen jointly. They don't train together. They don't coordinate treatment.
This is insane when you consider how tightly pregnancy and hormones are connected to mental health.
Pregnancy impacts hormones, sleep, mood stability, anxiety levels, cognitive functioning, physical stress, mental health impacts, prenatal care, postpartum recovery, bonding, breastfeeding, family stability, long-term maternal health.
And yet, the two fields act like distant relatives who only see each other at funerals.
This silos design leads to misdiagnosis, untreated postpartum depression, untreated anxiety, ignored trauma, preventable crisis, and dangerous outcomes. It's a small oversight and a structure failure. Insurance companies make mental health care as difficult as possible. Real world barriers, high copays, limited session, short-term therapy, only long wait lists, no integrated care, postpartum screening not required, mental health flagged as non-essential, medication approval requiring hoops. Women are left bouncing between OBGYN, primary care, psychiatry, therapy, pediatrician, insurance, portals, and the damn billings office, all while sleep deprived, overwhelmed, and in crisis. Insurance systems are great. One thing confusing the people who need care the most. One huge reason women mental health goes untreated. Women carry more underpaid labor than men in almost every country in the world. This includes
Childcare, household tasks, emotional support, scheduling, planning, remembering, elder care, keeping the social calendar, managing the family's life.
the average working mother works the equivalent of 2 full-time jobs. When do you get therapy? between bedtime and the next load of laundry. When do you get mental health care? During a lunch break you didn't take. Time is privilege, and women are not given enough of it. Here's a huge structural issue nobody talks about. We don't have enough specialists. We do not have enough perinatal psychiatrists, not enough trauma-informed providers, not enough menopause specialists, not enough therapists in rural areas, not enough bilingual mental health experts, not enough insurance coverage, therapists, period. So women end up
Untreated, misdiagnosed, placed on the wrong meds, put on 6-month wait list, or told to find someone online.
This isn't a women's problem. This is a workforce problem. We cannot ignore the cultural part of this. Women are raised to be
Strong, supportive, self-sacrificing, patient, resilient, emotionally mature, endlessly giving.
we are told,
You're so strong. You're a supermom. You always handle everything.
but here's the hidden message.
Don't ask for help. Don't be a burden. Don't fall apart. Don't show need.
Strength culture kills mental health. Motherhood in America comes with a trap. If you're struggling, something must be wrong with you, not the system,
You,
not the lack of support,
you,
not the impossible workload.
you.
So women hide symptoms, we hide exhaustions, we hide intrusive thoughts, we hide resentment, we hide trauma, because the expectation is be grateful, be strong, be smiling, and be perfect, which leads to one outcome: collapsed mental health behind closed doors. Let's map out every normal scenario a woman has.
Hormonal changes, sleep deprivation, anxiety, physical pain, trauma, emotional overload. She sees an OB, they say.
That's normal postpartum.
She sees a primary care provider, they say.
Try yoga.
She sees a therapist, they say.
Maybe you're overwhelmed.
She sees an ER doc, they say.
It's probably anxiety.
Nobody is coordinating. No one is sharing notes. Nobody is connecting dots. Fragmented care doesn't just cause delays, it causes harm. We glorify women's resilience so much that it becomes a weapon. Women are strong. Women handle everything. Moms are superheroes.
Yeah, but even superheroes need support. You know who doesn't need 6 phone calls to get a doctor's appointment? Superman. You know who never waits on hold listening to bad flutes? Batman. Women do every compliment about strength because pressure to endure suffering silently. Our workplaces still operate on the assumption that employees
Have a wife at home. Have no caregiving duties. Have uninterrupted availability. Can work long hours. Don't need leave. Don't need flexibility. The system was designed around male breadwinner.
and women are expected to fit themselves into like origami.
Flexible work is treated as favor. Paid leave is treated as luxury. Mental health days are treated like you ask for a yacht. This part hurts because it's intentional.
Women's health research has been underfunded for decades. Maternal mental health,
Underfunded.
menopause research,
Underfunded. Chronic pain disorders impacting women.
underfunded,
Endometriosis.
underfunded,
PMDD.
barely studied,
ADHD in women.
ignored until the 2000s.
You cannot fix what you do not fund.
So here's the truth. Women mental health isn't ignored by accident. It's ignored by design. We got it here because the system was built around men, funded around men, tested around men, staffed for men, and structured for men. Life patterns, women's didn't fall through cracks. The cracks were built into the foundation.
But if a system was built this way, it can be rebuilt. That's exactly what we're talking about next.
Hi guys, Tabitha Ziegler here speaking about women's mental health and how men can be better allies. I would say ask, always ask. Help is generally received. We've got a lot of single mothers out there, especially right now with children of disabilities, all types of disabilities, and don't just assume that someone is being hysterical. Most likely they have overcome a lot to be where they are, and sometimes a helping hand is needed. So for all of the policymakers out there, just try and put yourself in someone else's shoes.
All right, we've talked about the history. the fires, and the structural failures. Now it's time for the part that actually matters. How do we fix it for real? Not symbolically, not someday, not with hashtags, right now. And just like we always do and hold them accountable, we're not doing vague suggestions, inspirational posters. We're talking real policy, real reforms, real design changes. Paid family leave isn't a luxury, it's mental health infrastructure. When a country doesn't guarantee paid leave, here's what actually happens: mothers return to work before they're healed. Postpartum depression goes untreated. Postpartum anxiety skyrockets. Bonding suffers. Breastfeeding success plummets. Burnout becomes permanent. Sleep deprivation becomes crisis level. Families strain under impossible pressure. Paid leave reduces postpartum depression, anxiety, emotional instability, maternal mortality, infant health complications, financial stress. Paid leave isn't a handout, it's an investment. And for lawmakers who claim to be pro family, this is the bare minimum. One screening at 6-week appointment is not enough. Postpartum mental health conditions evolve over time. We need a screening at birth, a screening at 6 weeks, a screening at 3 months, and follow up pathways that aren't scavenger hunts. And guess what? Screening without treatment access is meaningless. You can't diagnose a problem and then say, good luck finding a provider, and please hold for 11 months. This right here is one of the biggest game changers.
Put mental health providers directly inside OBGYN practices. The single move solves half the pipeline problems. Why? Because during pregnancy and postpartum, the OB in the primary point of contact. Women trust their OB. They see their OB frequently. They're already in the building.
Integrated clinics mean instant, warm handoffs, shared records, shared treatment plans, no waitlist limbo, no insurance maze, no stigma, no gaps where patients fall through. This changes everything. We don't need new buildings. We need new blueprints. Right now, depending on where you live, your provider might know everything about postpartum depression or nothing. Training is inconsistent. Guidelines aren't enforced. Providers vary wildly in knowledge.
Every provider who touches maternal care, OBs, midwives, primary care, pediatrician, ER staff needs standardized training in postpartum depression, postpartum anxiety, postpartum psychosis, trauma response, hormonal, mental health, emergency warning signs.
Because the first provider who sees a symptom shouldn't be guessing. One of the biggest reasons women get misdiagnosed is simple: providers don't understand hormonal mental health.
Hormones affects mood, cognitive, irritability, sleep, anxiety, depression, motivation, and energy levels.
But many mental health professionals are not trained on hormonal cycles. So women get the wrong diagnosis, the wrong medication, the wrong treatment plan, or is just told it's stress.
We need hormone literate psychiatric and therapists, not generic mental health care applied the same way for men and women. This part matters because the U.S. workplace model was built for men in the 1950s, not working families in 2025.
Employer accommodations should include schedules, hybrid options, phased returns to work, mental health leave, pumping accommodations, childcare support, no retaliation for using benefits. Women should not have to hide mental health needs from their employer. This is not weakness. This is biology, caregiving responsibility, and social design.
Insurance is one of the biggest barriers to women's mental health. To fix this, we need mandatory coverage for postpartum mental health, expanded provider networks, reduced copays, telehealth parity, guaranteed therapy access, coverage for integrated care, simplified approval process, no more 6 sessions per year. What is that? A punch card.
When insurance treats mental health as optional, families suffer. There simply aren't enough providers. The solution: fund perinatal psychiatry fellowship, expand psychiatric nurse practitioner programs, incentivize rural and underserved coverage, provide loan forgiveness for maternal mental health specialization, build training pipelines, certify more menopause specialists, expand trauma-informed programs.
We don't need to fix mental health by giving people inspirational quotes. We fix it by building the workforce. We need national campaign, not to shame moms, not to guilt moms, but to inform moms. Public health messaging should include what postpartum depression looks like, what postpartum anxiety looks like, what postpartum psychosis looks like, what hormone shifts do, what support looks like, who to call, what is normal versus what needs help.
If we can run nationwide campaigns for cholesterol, we can run one for maternal mental health. Menopause support must catch up to reality. We need dedicated menopause clinicians, updated medical guidelines, better HRT education, insurance coverage for menopause care, mental health support during perimenopause, screening for mood disorders, primary care training, and menopause management.
Women shouldn't be white knuckling their way through a decade long biological transition. You cannot fix mental health without addressing the invisible load. The load includes household management, emotional regulation of kids, remembering everything, planning everything, anticipating everyone's need.
Policy solutions include subsidized childcare, after school program expansion, tax credits for caregivers, promoting household equity, educating fathers on maternal load distribution. The mental load is not natural, it's a sign. Mental health should be treated like blood pressure, heart rate, weight, glucose, measured, monitored, standard, not optional, not if time allows. Every appointment should include mood check, stress assessment, sleep review, emotional load screen, risk factor screening.
Mental health should be a vital sign, period. We need to be very clear. Women's mental health care cannot be revolved around motherhood. Women without children face
Workplace discrimination, hormonal conditions, stress, trauma, chronic illness, menopause, caregiving burdens, societal expectations.
and you don't need to be a mother to deserve mental health care. You just need to be a human being. We can just use tech the right way.
Teletherapy, telepsychiatry, remote screening, app-assisted mood tracking, digital aftercare, rural access solutions,
But we must avoid
predatory mental health apps, replacing clinicians with chatbots, data harvesting, algorithmic bias.
tech should make care easy, not cheaper. We need federal leadership.
This includes national maternal mental health standards, federal postpartum leave, national workplace protections, federal insurance mandates, national data tracking, national menopause care guidelines, federal maternal mental health task force. Right now, your mental health care depends on your zip code. That is unacceptable. So here's the truth. We are not lacking solutions. We are lacking political courage. The fixes are clear. The data is clear. The benefits are clear.
If lawmakers wanted to fix women's mental health tomorrow,
They could.
if employers wanted to support women,
They could.
if insurance wanted to reduce barriers tomorrow,
They could. This isn't impossible. This is intentional. And that means it's changeable.
The best advice I can give to men about their woman's mental health and overall well-being is to understand patriarchy and how male dominance has changed. Women can be head of household now. Women can be the major breadwinner. Women may have a higher degree than you. She carries her weight, and she needs a partner in life who carries his weight too, who is present, who respects the way she feels, who pays attention and listens, and who still loves her and stands by her. Especially when she tells you she is overwhelmed, she is hurt, she is crying. Do not get angry. Just listen, try to understand, and give her a hug. It's so simple. She doesn't need you to solve it. She needs you to care. Then, since action speaks louder than words, take action. Help raise the children, cook dinner, do laundry, be involved without being asked.
All right, it's time. This is the part of the show where we stop being polite start being honest. Because if us talking about women's mental health for this long and you still don't get it, then honestly, I'm not sure you belong anywhere near policy, healthcare, or a microphone. So let's play a little game we like to call Hold 'em or Fold 'em. If you're a lawmaker who gets on a stage, talks about being pro family, takes photos, kissing babies, and then turns around and votes against paid family leave,
Fold, fold, fold immediately. Fold so hard the table breaks.
paid leave is the single most effective thing we can pass tomorrow to protect mothers' mental health. If you vote against paid leave, you are not pro family. You're pro slogan. And slogans don't save lives. If you can recite scripture but can't recite maternal mortality statistics,
Fold,
if you claim you value life but can't be bothered to fund maternal health care,
fold,
if your policies make pregnancy more dangerous instead of safer,
fold. Maternal mortality is a crisis, a preventable crisis, a national embarrassment.
if you're not fighting to fix it, you don't get to preach family values to anybody.
You can't say mental health matters and then quit the budget for therapists, schools, counselors, social workers, and postpartum programs.
That's not leadership. That's PR. If you use the phrase mental health crisis as a talking point, but vote against funding to address the mental health crisis,
Hold 'em hard.
if your company requires a woman to file 7 forms, get pre approved, and sacrifice a goat under a full moon just to get a therapist covered,
Fold,
if you cover 12 therapy sessions per year, what is that? 1 per menstrual cycle?
fold,
If you don't cover postpartum mental health,
fold,
if you deny hormone treatment because women's symptoms vary,
fold your entire business model. Insurance shouldn't be an escape room where there's prize to surviving childbirth.
and if your employer who discourages leave, punishes flexibility, retaliates when women take time off, mocks mental health days, pressures moms to come back early, and says, we're a family, but treats everyone like disposable labor,
Fold 'em,
if your office culture makes women choose between their sanity and their paycheck,
fold 'em,
if your company celebrates productivity but ignores burnout,
fold 'em twice.
if you're a provider who hears a woman describe pain and your first reaction is, it's probably stress, or have you tried relaxing?
Fold,
If a woman tells you she's overwhelmed postpartum and you say that's normal instead of screening her properly,
fold,
if you treat women's pain as emotional but men's pain as medical,
fold. There's no sugarcoating this. Dismissal kills. Delayed care kills. Bias kills. If you can't take a woman seriously, you can't practice medicine.
if your first reaction to women's mental health needs is to blame women,
Fold.
why don't women speak up sooner?
Because when we do, we get judged.
Why don't women ask for help?
Because help isn't accessible.
Why don't women take breaks?
Because society punishes us when we do.
Fold every last person who thinks individual willpower solves systemic failure. If you dismiss women's mental health as a niche issue,
Fold,
if you treat half the population like they're a special interest group,
fold,
if you think postpartum depression only affects moms and not entire families,
fold,
if you think menopause is just hot flashes and not major mental health transition,
fold.
you cannot build a healthy country while ignoring the mental health of the people holding most families together. Let's be fair. Not everyone gets fooled. There are people worth holding and supporting and amplifying. We hold lawmakers pushing for paid leave,
Employers who actually support families.
OBGYNs fighting for integrated mental health care, therapists trained in hormonal mental health, advocates fighting mental mortality,
Nonprofits supporting moms.
researchers studying moms' mental health,
Partners carrying the mental load equally.
women telling their truth despite stigma,
Survivors fighting for better care.
communities supporting each other. These people, these are the ones worth holding. And here's the thing, this isn't a card game. This is real life. If we fold the wrong people, families suffer. If we hold the wrong people, women suffer. But if we get this right, if we hold the ones who show up for women and fold the ones who pretend to, we change the game.
I suffered much of my youth and young adulthood with panic attacks and raging hormones. I did not seek medical help due to lack of insurance and country doctors. I was adept at blaming my hasty exits or avoidance of triggers on a variety of excuses. Putting up with severe migraines triggered by monthly fluctuations, water retention, bloating, horrible periods causing me to keep a change of clothes at work and in my car for years. Having difficulty conceiving, I saw several doctors and finally one doctor suspected thyroid issues and sent me for testing. Sure enough, that was the main issue. Following medicine to settle the thyroid storm and then surgery to remove 80% of my thyroid, it still took them 5 years to start me on thyroid medication. The panic attacks lessened and eventually disappeared. By this time I was perimenopausal. My family doctor told me my migraines were hormonally triggered, and once I was through menopause I'd probably never have another, and that has proved to be true. After a roller coaster of hormonal imbalances, I was pleased when I breezed through menopause with nary a problem. I think women's health issues took a backseat as far as research and care for far too many years. We were considered hysterical, the weaker sex, expected to function at 100% and smile. We were passed up for promotions more often than not because men perceived us as a risk because of our instability or our risk of becoming pregnant. I've been out of the workforce many years, but I doubt much has changed. I think most people would not seek out an endocrinologist or find a super bright OB/GYN. I think hormonal imbalances are often overlooked in females and are usually only found when problems develop. There is still a stigma about mental health issues. Rural areas have no access and family doctors are not equipped. My friend suffers from PTSD from trauma in the military, and when she went for help they blew her off. Years later, and after years of suffering, she was finally diagnosed and sees a counselor regularly now. Finding a competent counselor is another story, and unless you have great insurance you will not get care. I worked in healthcare 30 years and no women were not taken as seriously as men with health issues. I hope and pray some of these things are changing, but I'd like to see more training for health professionals, first responders, and law enforcement for how to deal with and approach people in a crisis. We need to teach our sons to be more empathetic with women they are in contact with throughout their lives and not blame everything on the monthlies or menopause for all conflicts with the opposite sex. I love the saying, men are the problem. Menstruation, mental illness, menopause.
Tonight, we've talked about a lot of history, a lot of pain, a lot of frustration, a lot of receipts, a lot of things that should have been fixed decades ago. And if you're sitting there and thinking, why does it feel like women have been carrying the weight of an entire society on their backs? The answer is simple, because they have.
And we have been doing it a while, smiling while working, while raising families, while keeping the light on emotional and financial, while doing the invisible labor that holds entire communities together.
And they've been doing it inside a system that was never built for them in the first place. So let me say something clearly. As a retired Marine, as a father, as a husband, as a human being with a soul, women are not the problem. The system is the problem. Full stop. Women aren't breaking down.
We are breaking under pressure that no one should be expected to carry alone.
Women aren't too emotional.
We are exhausted from being dismissed when they try to speak.
Women aren't overreacting.
We are reacting to decades of being underdiagnosed, under-researched, underpaid, and undervalued.
Women aren't doing it wrong.
We are doing everything inside of a world that gives us half the support.
And here's the truth a lot of people don't want to say out loud. A society that ignores the mental health of women is a society that does not understand its own survival. You want families to thrive?
Support women.
You want children to grow up healthy.
Support women.
You want workplaces to be productive.
Support women.
You want communities to flourish.
Support women.
You want the next generation to have a fighting chance.
Then support women.
Because when women fall, everything falls.
When women rise, everything rises.
And I know, for some people out there, this kind of conversation makes them uncomfortable because accountability always does. It's easier to blame individuals than systems. It's easier to hand out platitudes than resources. It's easier to post a hashtag than fight for real change. It's easier to say, be strong, than to build a world where strength isn't required to survive. But that's not who we are here. Not on this show. Not on Hold 'em Accountable.
Not in our house, not in our family, not in our state.
We tell the truth, even when it stings. We show the receipts, even when they make people swerve.
And we demand better, not because it's easy, but because it's necessary.
Look, we don't have all the answers. We aren't pretending to, but we do know this. Women deserve care. Women deserve support. Women deserve to be believed. Women deserve to be safe. Women deserve to be healthy, mentally, physically, emotionally, and women deserve a system designed with them in mind,
Not as an afterthought,
not as a budget line.
not as a campaign talking points.
As human beings, as the backbone of our homes, our workplaces, our communities, our future. So if you are watching tonight and you've ever felt unseen, unheard, unsupported, or dismissed, I want you to hear this from us directly, clearly, without a shred of hesitation. You are not broken.
You are not weak.
You are not failing.
You are not alone.
You've been carrying an impossible weight in an unfair system, and you deserve better. If you love someone struggling,
Stand with them.
if you are that someone struggling,
Reach out.
support isn't weakness.
It's humanity.
And if you're a policymaker, an employer, a provider, or anyone with power watching this, the ball is in your court. You know the problems. You heard the receipts. You know the solution. We spelled them out for you tonight. So ask yourself, are you going to make excuses?
Or are you going to make a change?
Because women don't need more pep talks.
We need action.
And action starts with accountability. This has been Hold 'em Accountable. I'm Derek Holder, husband, father, neighbor, citizen. Someone who believes we don't build a better future by ignoring the people who hold it together.
And I'm Kristie, wife, mother, and host of the upcoming new podcast, Breaking the Silence with Hold 'em Accountable. Also, another thing I just wanted to tie in real quick is if you're struggling with mental health and you're looking for the right proper medication, I would suggest asking your provider to look at gene site testing. I'll tell you right now, it's helped me.
Thank you for watching, and thank you for caring, and thank you for fighting in big ways and small for the people you love. Take care of yourselves, take care of each other, and as always, let's hold them accountable.